I think curiosity in a physician is so important. I really want my doctor to want to understand the root causes of my problems and be curious about what's happening and finding a solution. One thing about being young and having a lot of pain is that a lot of people don't necessarily believe you or take you super seriously. You're young, you're supposed to be healthy. I'm a relatively energetic person, and I think that can sometimes cause doubt for what you're experiencing. So I think that can be a challenging element of it, and it can be a challenge to be able to function well and to know what you need to do your day-to-day life, but also be experiencing pain while doing that, and not always be sure how to express that or in what ways. She was my primary care physician just out of chance, just because she was the first person that had an appointment available. Going to the doctor, especially a new doctor, tends to make me a little nervous, but she was a really attentive provider. She spent a lot of time with me. I came in with a lot of different things I wanted to discuss that day and kind of a almost laundry list of things I wanted to start addressing and looking at more seriously. She really took a lot of time with me to sit and ask if I had any other questions, talk about what we could do, and just really address all of my concerns, which was so helpful. I've seen different providers when I've had emergency situations happen at Piedmont Health before, and they've all been wonderful, so nothing but good things to say about the whole organization. But I do see her as my regular physician, and she is who I message when I have questions or follow-ups or have seen other specialists, and that is always so nice to know that I'm going back to a PCP that I really trust and I feel like I have a good relationship with, so that no matter what is happening in different other factors, that is a very solid place to be. Being a student and also working and having a very full schedule in life, chronic pain can feel like I don't have time for this, or this is something that doesn't really fit within the life that I kind of need to live to be able to get my to-do list done. And I think being able to discuss what are some options for this, what can we look at and explore, A, provides a lot of hope in that you think this might get better and this might not be forever, but B, also just provides a sense of relief in that there might be solutions even if we don't always know the root causes, to be able to let me live a less painful life and have more freedom and more capacity in my day-to-day. If they have poor experiences in the medical system, can feel really hopeless and feel like no one will ever take me seriously, this is not worth exploring. I kind of a sense of this is just my life. And I think that's really understandable, but I think it's really important to advocate for yourself and find a physician that does take you seriously and know that those people are out there. I'm Emily McNutt, and this is my uncommon sense approach to more good days.